Hello, everyone. Good evening. Thank you for joining us. From the list of registered people, I see that we have some healthcare providers. We have also some patients, probably some others also interested in duodenal switch or obesity in general problems. So let's get started. At the end of presentation, I will try again to answer some questions. So please send your questions while I'm talking. You can also watch our webinar on Vita.G supplement Facebook page live, and you can review it later if you want to. Again, I want to thank Vita.G company for sponsoring this webinar series. Last time we talked about BPD duodenal switch procedure itself, so please refer to our previous webinar, which you can find on Facebook or on Vita.glab.com in educational media section. This time we'll touch nutritional implications after duodenal switch. And hopefully next time we'll be able to cover some possible surgical complications after the duodenal switch. So personally, I have performed at least 2,000 major bariatric operations, and I still notice that many patients are confused with their supplementation, despite quite a few companies offering their products. I feel that this topic is very important, and especially it's important to talk from a surgeon's perspective. Now, before we start talking about duodenal switch implications to nutrition, let's review some definitions because it is important to understand what we're talking about. So what is nutrient? So nutrient is a substance that provides nourishment for growth and metabolism. And there are a few categories of nutrients. We have macronutrients, which provides energy, and we have micronutrients, which supports metabolism. Now, first big category of macronutrients is carbohydrates. So carbohydrates are compounds made of types of sugar, and they are classified according to their number of sugars of sugar units. Now, if you have one sugar unit, it's going to be monosaccharide. That would include glucose and fructose. If you have two sugar units, you would have disaccharide, which would include sucrose and lactose. And if you have more than 2 units, it would be polysaccharide, which would include starches, glycogen, and cellulose. Now, the second big group is protein. Proteins are organic compounds that consist of amino acids, and they are joined by peptide bonds. Now, through digestion, proteins are broken down to amino acids, and that's how body absorbing amino acids through the intestine. The third essential group is fat. Fats consist of glycerin and 3 fatty acids. Fats are needed for construction and maintenance of cell membranes. It is also important for stabilizing body temperature as well. Now, micronutrients, as I mentioned before, they support metabolism. Dietary minerals, and micronutrients in general are in 2 big categories, minerals and vitamins. So minerals would include all trace elements, salts and ions, and these specifically are potassium, chloride, sodium, calcium, phosphorus, magnesium, iron, zinc, manganese, copper, chromium, molybdenum, selenium, and cobalt. Vitamins are, from other hand, they are working mostly as coenzymes to participate in various protein functions. So they are kind of helpers for protein functions. And you have two big categories, water-soluble and fat-soluble vitamins. And we'll go into a little bit more details a little bit later. Now, some of the nutrients are more important than others, and especially the ones that our body cannot synthesize. Nutrients that are required for normal physiologic functions but cannot be synthesized in the body, they are called essential nutrients, and they must be obtained from a dietary source. Now, we have 9 amino acids, 2 fatty acids, 13 vitamins, and 15 minerals that are considered to be essential nutrients. Now, let's review this normal physiology graph, and it is important to understand normal physiology, at least some important details, which is going to be important to know when we're going to talk about duodenal switch and reconstruction and which parts of the bowel is going to be bypassed. Now, human GI tract is a complex physiologic system that is responsible for consumption, digestion, and absorption of all these nutrients we talked about. Besides that, GI tract is also an important integral part of metabolic signals and plays important part in metabolic syndrome development. So after food is swallowed in the stomach, and in the stomach, food is basically stored for prolonged acid exposure. And then pepsid is activated, which in turn cuts protein into amino acids. At the same time, acid facilitates release and dissolution of calcium, magnesium, iron, and other trace elements for later absorption. Stomach also produces, which is called intrinsic factor for B12, and this intrinsic factor later facilitates B12 absorption in the last portion of the small bowel, which is called ileum. Majority of digestion and absorption occurs in the small bowel, and then in the small bowel where you have bile and pancreatic juice with digestive enzymes, but gastric content enters the intestine through pylorus, and that's important structure to remember because in duodenal switch procedure, this valve, which is called pylorus, is preserved and it is functioning. Breakdown of macronutrients is facilitated by these digestive enzymes from bile and pancreas, but macronutrients also are digested by intestinal brush border enzymes. So protein and carbohydrates are broken down and absorbed through entire small bowel. Fats are a little bit more complex. They are first emulsified by bile, and then from micelles, they form micelles, which includes fatty acids, cholesterol, and also fat-soluble vitamins. All of that is transferred into the lymphatic system and then into the bloodstream. Fat absorption plays a major role in fat-soluble vitamins, A, D, E, K absorption. And that's important point in duodenal switch, as you're going to see a little bit later. So fat-soluble vitamins are absorbed through all intestine, but most efficiently it is absorbed in actually the distal part of the small intestine, which is called ileum. Now, micronutrients, vitamins, and minerals kind of the same like macronutrients. They are absorbed through all small intestine, but some of them, such calcium, iron, zinc, magnesium, and copper, are mostly transferred in duodenum. So, for example, calcium is absorbed after it's exposed to after it is exposed to the acid, and more acid you have, the better absorption of calcium you're going to have. And you're going to see in duodenal switch, you have slightly smaller stomach, so that's going to be affected. Also, calcium, it is dependent on vitamin D transport system. So if you have vitamin D deficiency, so that may worsen actually calcium absorption. Now, copper is interesting in regards of competing with the zinc. So it competes with zinc for absorption. So aggressive supplementation with zinc may lead to copper deficiency. So correct ratio of these two may resolve the problem. Talking about iron is kind of like a calcium, when it improves absorption if it stays in an acidic environment for some time. So that would happen in the stomach. And then iron is mainly absorbed in duodenum, pretty much as calcium and copper. Now the colon, the last portion of the digestion system, serves to absorb dietary and secreted water, some electrolytes and vitamins as well, especially vitamin K, which is mostly produced by microflora in colon. In duodenal switch, this portion is actually intact and it's not bypassed, so really doesn't change much at all in duodenal switch. But colon also is an important place for microflora, where over 1,100 of species of bacteria and yeast inhabits. So physiologic importance of microflora remains an important area in study within the field of obesity. Now let's take a look briefly into duodenal switch, how it's reconstructed in anatomy. So I'll talk about duodenal switch and loop duodenal switch anatomy, just again to review everything and understand how which parts are bypassed and when you're going to have potential malabsorption of some specific elements. Again, it is important to remember that this is not the same operation as classic Scopinaro operation, or also known BPD, biliopancreatic diversion without duodenal switch. So please refer to my previous webinar talk about the procedures. I have explanations in details over there. But in general, again, with duodenal switch, we are decreasing size of the stomach, which is vertical sleeve gastrectomy. So we have less acid, and that will be affecting some of the, especially micronutrient absorption. At the same time, we are preserving pylorus, which is also an important point, and that pylorus preservation prevents dumping syndrome, which is a very common problem in gastric bypass, but it is not common at all in duodenal switch, and it's pretty much not even well described in duodenal switch. Now, besides the pylorus preservation, we have also about 2 to 4 centimeters of duodenal stump. This is very important because it plays a very important role in some of the mineral absorption. So you still have a portion of duodenal switch, portion of duodenal stump, which is not true in gastric bypass, for example. And then you have elementary limb, which is between first and second connection. Then you have common channel, and common channel is from a second connection to down to the colon. And the green here shown actually is biliopancreatic limb, where bile and pancreatic juice is coming. Now, loop duodenal switch is quite similar, so it's essentially longer common channel duodenal switch, and you have bile and pancreatic juice mixing up from the very first connection, and you do not have the second connection. Now let's review one by one specific problems patients may encounter with BPD duodenal switch or loop duodenal switch. We'll talk about macronutrients, micronutrients, and vitamins. In regards of macronutrients, it is believed that mechanism by which duodenal switch results in weight loss is mainly by limiting fat and carb absorption. And thus, you have also energy absorption limitation to certain threshold. As a result, energy absorption would not exceed this threshold, despite if you're going to try even overfeed with carbs or fat. So in contrast, protein is a function of dietary intake. So study shows that protein is being absorbed not only in common channel, but also it is absorbed in alimentary channel, where mostly brush border enzymes are breaking down protein. Therefore, adequate protein intake is paramount importance to maintain normal levels. Recommended protein intake for duodenal switch patients is about 100 grams per day. Now, some recommendations go up to 120 grams per day. And again, the more of protein you're going to be consuming, the more protein you're going to be absorbing. If patient is consuming good amount of protein with food, they may need only 30 or 60 grams of supplementation. And important to remember that with time, requirements for supplementation usually kind of decrease just because there is a bowel adaptation, and people also with time, they can eat slightly bigger portions as well. So what is the best protein source for duodenal switch patients? Usually is whey protein. It's best because it has the highest amount of branched chain amino acids. Now, high quality whey isolate, not concentrate, contains essentially no lactose. And this is important for duodenal switch patients because a lot of times duodenal switch patients become somewhat lactose intolerant. Now, in regards to fat digestion, in duodenal switch, it is important to understand that the absorption happens mostly in common channel because the mixing of food with bile starts from the second connection and a common channel. Malabsorption of fat results in significant reduction of blood cholesterol, but at the same time, it decreases absorption of these fat-soluble vitamins. So consumption of more fat only is just going to increase diarrhea-type symptoms, but it will not increase vitamin absorption. Therefore, adequate supplementation of fat-soluble vitamins is recommended. Carbohydrates in duodenal switch are absorbed in common channel and alimentary channel. But increase of carbs usually just results in significant flatulence. And so most patients actually try to avoid consuming too much carbs. Now, talking about micronutrients and minerals, iron is absorbed in duodenal stump. So it is also an important feature of duodenal switch that duodenal stump allows to absorb some iron, and also iron is absorbed in the other parts of the small bowel, which would be alimentary channel and common channel. Now, a good portion of duodenum is preserved in duodenal switch. Therefore, iron deficiency anemias are potentially less common than in, for example, like in gastric bypass, where you have completely bypassed the duodenum, so you don't have any even small portion of duodenum participating in digestion or absorption. Now, symptoms if developed deficiencies usually are related to microcytic anemia. You may have some heart palpitations, decreased immune function. So recommended dosage goes from 18 milligram to 60 milligram per day. And that depends a little bit on your age, male, female. Now, iron usually does not taste good, but you need to choose. Either you want to take one tablet with iron included in the multivitamins, or you need to take separately 2 tablets, such as multivitamins without iron, and then separately iron. If you take separately, it is probably more likely to be a compliance issue with time, because more tablets you take, more likely that you at some point either going to miss them or just are going to start ignoring them. Now, calcium and vitamin D, usually they go together because calcium, again, that depends on vitamin D transportation system. In duodenal switch, the calcium is absorbed partially in that remnant duodenal stump, and also in the entire rest of the small bowel, which would be alimentary channel and common channel. So if you develop symptoms of calcium deficiency, that usually goes with cramping, low calcium levels, and obviously some bone problems as osteoporosis. Recommended dosage of calcium would be 1,200 up to 2,400 milligrams per day. The best form of calcium is usually calcium citrate, because it requires less acidic environment, and that's what happens in duodenal switch, because your stomach is smaller, so you have a little bit less of acid. So calcium citrate is recommended form for supplementation in duodenal switch patients. Now, calcium and iron should not be taken together because it cancels each other. So in most regimens with most companies, you're going to have calcium separate and iron separate. Next microelement would be zinc. Zinc, remember, competes with copper for absorption. So if you have too much of one of them, so you will become deficient with the other. Absorption in duodenal switch, zinc is absorbed in duodenal stump and alimentary limb and common channel. So things to look for in zinc deficiency, some hair loss, delayed wound healing, nothing really much specific, but obviously you need to check your zinc levels in the blood. So recommended dose goes from 15 to 22 milligrams per day. Selenium, absorption in duodenal switch. Again, you have duodenal stump, and you have small bowel absorption from alimentary channel and common channel. Symptoms if deficient, there is no, again, good clinical repercussions, but usually it's something to do with immunosuppression, and also there are a few cases described that selenium can cause cardiomyopathy, and if you replace selenium, actually cardiomyopathy could be even reversed. Recommended dosage is 70 micrograms per day. Copper is associated with low white cell count, and if neutrophils, which are the first in line defense system, if they decrease, so frequent infections may occur, and sometimes patients complain of feeling cold. That would go with copper deficiency. Now, vitamin A is one of the fat-soluble vitamins. So as we talked before, the fat-soluble vitamins are usually absorbed only in common channel. So if you develop vitamin A deficiency, night blindness, something to do with vision usually, difficulty seeing in dim light, also something to do with wound healing. Patients may have loss of taste and or dry skin. So recommended dose for duodenal switch is 10,000 international units per day. Vitamin D, again, goes, usually deficiency goes together with calcium, and we already talked about calcium deficiency. Now, vitamin E is important for neurologic damage, and patients may have gait disturbance, and recommended dosage is about 15 milligrams per day. Now, vitamin K is very important in duodenal switch, because it is absorbed in common channel like as other fat-soluble vitamins, but also it is partially absorbed in the colon as well. As you remember, in colon, there is a microflora which produces vitamin K, and some of the vitamin K is reabsorbed also through the colon. Now, vitamin K is important in clotting cascade, so deficiency would lead to some kind of hemorrhages. So that would go with easy bruising, bleeding of gums, delayed clotting, nose bleeding, and so forth. Now, also important to notice that patients who are on Coumadin, they probably going to have some trouble actually regulating Coumadin levels, because Coumadin is related to vitamin K function, so it is dependent on vitamin K. Recommended dosage is 340 micrograms per day. Now, let's talk about a few of water-soluble vitamins. B1 or thiamine is absorbed because, again, it's water-soluble vitamin, so it is absorbed in all small bowel, including alimentary channel and common channel. Symptoms if deficient with thiamine, you may have, which is called beriberi disease. There are two flavors of this disease, with swelling and without swelling. Now, the most feared, I guess, complication of thiamine deficiency is called Wernicke-Korsakoff syndrome, where you have gait problems, mental impairment, encephalopathy, and sometimes even psychosis. So recommended dosage is about 12 milligrams per day. And recently, as you probably know, that ASEAN-BS recommendation significantly increased thiamine requirements. Now, folate and B12 both are absorbed in alimentary channel and common channel, but B12 requires intrinsic factor in order to be absorbed in ileum. And due to sleeve gastrectomy, you have decreased production of intrinsic factor, so therefore decreased absorption of B12 is going to be noticeable. So symptoms, if deficient, usually goes with some specific, which is called megaloblastic anemia. You may have beefy red tongue, numbness and tingling, ringing in the ears, and so forth. Now, recommendation is about 500 micrograms per day. Both folate and B12 are extremely important in pregnant women, so deficiencies are associated with birth defects. Now, what would be recommendations of supplements for BPD duodenal switch, or how do we avoid deficiencies? Now, regular follow-up with your physician is of paramount importance. Labs and blood work once a year must be done, and then you can adjust your supplementation if needed. So, regular intake of specialized supplements and vitamins is required, and depending on the brand, your regimen could be slightly different. But mainly it differs how many tablets you would be taking. Now, if you choose to take bariatric advantage, so daily regimen according to their website is, at least 2 tablets per day, high ADEK, and this actually high ADEK multivitamin does not cover even 2 tablets per day vitamin K requirements. But then besides multivitamins, you also need to take calcium, which is 3 times per day. And calcium 3 times per day is going to be no matter which brand you are going to choose, because if you take your calcium in one in just one whole dosage requirement per day, it's not going to be absorbed. So you need to take and distribute that at least 2 or 3 times per day. Now, besides that, obviously you need protein, and high protein meal with high protein shake actually with Bariatric Advantage gives you about 20 grams per serving. Now, if you choose Celebrate regimen, you would need to take 3 tablets with multi-ADK per day, then plus calcium, as with other companies. And then you have high protein meal replacement, which gives you 27 grams per serving, 2 scoops, which is a little bit higher volume of the protein powder. Now, if you choose Vita.G company, daily regimen would consist of DS multivitamin, 1 tablet per day. Then DS calcium would be 3 times, like with any other company. And then DS, special duodenal switch whey isolate protein would give you 27 grams per serving, which is just 1 scoop and gives you 27 grams. Now, in general, obviously, follow ASMBS recommendations for maintenance and adjust if needed according to your lab results. You also want to make sure that your tablets are chewable, and you should not be swallowing these tablets as a whole. As a surgeon, I know some occasions when people have pills, stuck in their connections, causing obstruction, with sometimes requiring operations. Now, preferably, you would want to find vitamins lactose and gluten free, designed for sensitive gut. Some of the brands, such as patches, may not be proven to work, and absorption depends on multiple factors, such as skin thickness, sweating, hair, and so forth. So some other brands may have insufficient dosages of supplements, especially for duodenal switch. And some other brands may require too many tablets to keep track of your daily requirements. Now, in conclusion, BPD duodenal switch is a restrictive and malabsorptive operation, so therefore appropriate supplementation is essential to maintain normal body functions. Regular dosages of generic common multivitamins are not sufficient to cover all your post-surgical needs. So thank you very much for participating. Now I will try to answer maybe a question or two. We obviously ran a little bit more over time, but let me see if I can find something to answer. Okay. All right. There is one question. I think it's a good question to discuss. Is it possible to develop protein or vitamin deficiencies if I take my supplements? Yes, but definitely you need to consult with your surgeon or your physician, your primary physician. Usually, first step would be to adjust your dosages of supplements, or maybe sometimes actually try to change your brands, the brands of the multivitamins, because again, for example, if you're using patches, they may not be working as well as you're expecting, and most appropriate supplementation would be with chewable tablets. So if you adjust all these things and it still doesn't work, so next step would be actually to consider pancreatic enzymes. Pancreatic enzymes essentially would be a medical elongation of common channel. So if you tried all of these things and it still doesn't work, then obviously you would want to maybe discuss with your surgeon where maybe surgical interventions may need to be considered, such as maybe common channel elongation procedure, or maybe even reversal if needed. So let me see, maybe one more question I can get. All right. Okay, so question is, is loop duodenal switch any different in regards of supplementation? Well, unfortunately, there are no specific recommendations for loop duodenal switch, but I think that BPD duodenal switch is the closest reconstruction with very similar possible deficiencies. It is essentially longer common channel duodenal switch. So therefore, I would recommend regimen designed for duodenal switch. Now, I don't think we have any more time to answer any other questions. You can send us email to maybe ask more questions if you would like to discuss more. But thank you very much for participating. Always discuss with your surgeon or physician whatever problems you have with supplementation or in general, and good luck. Thank you for participating.